Okay, so if you've ever had a dog with those nonstop chronic skin allergies, you know exactly how frustrating it is. I mean, the constant scratching, the endless vet visits, the medications that seem to work for a bit, but the problem never really goes away. But what if the real solution isn't another cream or a different pill? Today, we're going to dig into a fundamental cause of that itch that often gets missed, a cause that starts deep, deep inside your dog's body. And this is the question, right? It's the one that probably keeps you up at night. You give them the medicine, the itching stops, and you finally breathe a sigh of relief. But the second you stop that medication, boom, you're right back to square one. It feels like this hopeless cycle. But, understanding the answer to this one question, well, it changes absolutely everything. And here it is. This is the first big mind shift we need to make. We're all so focused on the skin, right? I mean, that's where we see the problem, the redness, the scratching, the hot spots. So naturally, we treat the skin. But what if the skin isn't actually the battlefield? What if it's just the place where the damage shows up? That's exactly it. The real problem, the actual source of all that misery, is an internal battle. It's a system-wide issue that's just screaming for attention on the body's biggest organ, the skin. So to really get this, we've got to go a little deeper. And that brings us to the gut. Now, it's easy to think of the gut as just, for digestion. But in reality, it's one of the body's most massive and important immune filters. Think of it like a gatekeeper that's making crucial decisions every single second about what gets into the body and what has to stay out. And when that gatekeeper starts to fail, well, that's when all hell breaks loose. The name for this failure is leaky gut syndrome, or if you want to get technical, increased intestinal permeability. And honestly, this concept is at the very heart of everything we're talking about today. It's a condition where the barrier of the gut lining starts to break down, creating these tiny microscopic holes that let things through that should never get through. This is where the internal war really begins. So to really wrap our heads around this, let's use an analogy. It helps to think of the gut not just as a tube, but as a seriously well-defended fortress. I want you to picture the gut lining like it's a giant fortress wall. Its job is to be smart. It has these special gates that are designed to let all the good stuff, the nutrients from food, pass through into the city, which is the bloodstream. But at the same time, its job is to keep all the bad guys out. We're talking toxins, harmful bacteria, you name it. So what holds this wall together? It's not just bricks, which are the individual cells. The really crucial part is the cement that holds all those bricks together, making sure there are no gaps. In the gut, that cement has a name: tight junctions. These are proteins, and their one and only job is to keep that wall sealed and secure. They're the guardians of the fortress. So, what could possibly break down the super important cement? Well, there are a few things that act like a wrecking ball on those tight junctions. Chronic low-grade inflammation is a big one, and that's often fueled by the wrong kind of diet. The overuse of antibiotics can also be a factor, wiping out the good bacteria that help protect that gut lining. Over time, these things cause those tight junctions to get loose, and suddenly the fortress wall starts to get cracks. Okay, so the wall is breached. What happens next? Well, this is where the body's immune system gets the shock of its life, and a full-blown immune storm kicks off. The main bad guys that sneak through those new cracks are called endotoxins, specifically a type known as lipopolysaccharides, or LPS. Now get this, inside the gut, these things are totally normal, no big deal. But once they get into the bloodstream, whoa. It's like sounding a 5-alarm fire for the immune system. They do not belong there. And this is the catastrophic chain reaction that follows. It's a domino effect. First, those endotoxins start flooding into the bloodstream through that leaky gut. Then, the immune system goes on red alert, sees these invaders, and launches an all-out attack. But since this is a constant flood, not a one-time thing, it triggers chronic, system-wide inflammation. And finally, all that inflammation has to go somewhere. For many dogs, it settles right in the skin, causing its own barrier to break down. And that is where you get the intense itching, the redness, and the misery. Okay. So now that we know what's really going on under the surface, let's go back to those medications we talked about at the beginning. Let's figure out why they only ever feel like a temporary fix. And this analogy just hits the nail on the head. The leaky gut is the broken faucet constantly gushing these inflammatory endotoxins into the body. The itchy, inflamed skin, that's the water flooding the floor. So what are conventional drugs like steroids or Apoquel doing? They're just mopping up the water. And they might do a great job of it. The floor looks dry for a while, but they never, ever touch the gushing faucet. This really breaks it down, doesn't it? On one side, you've got symptom care. That's wiping the floor. It works by either muting the immune system or just blocking the itch signals from getting to the brain. It is, by definition, a temporary fix. On the other side, you have fundamental care. This is about fixing the faucet. It's focused on stopping the toxins from getting in and actually repairing the gut lining itself. One's a band-aid, the other is a real solution. So the big question is, how do we actually fix the faucet? How do we solve this thing at its source? Well, the whole idea is to stop managing symptoms and start rebuilding the body's natural defenses. The goal here is really straightforward. We have to physically block those endotoxins from ever getting into the bloodstream in the first place. And that means we have to go in and repair that fortress wall, the gut lining, and restore its function as a strong, healthy barrier. And the game plan to do that has three main parts. First, you have to rebuild those tight junctions. You have to add new cement between the bricks. That means giving the body the right nutrients to patch up the wall. Second, you want to purify the gut's environment, making it a place where good bacteria can thrive and the bad guys can't. And third, you can use specific therapies to block those inflammatory pathways that are already running wild throughout the body. And this quote says it all, doesn't it? If you remember just one thing from this entire explainer, let it be this. The problem you see on the outside, on the skin, is not a skin problem. It's a gut problem. To truly fix the skin, you have to start from the inside. So at the end of the day, what's really needed here isn't a stronger drug to shut the immune system down. The real, lasting solution is to functionally reconstruct the body's own defense system, starting with that gut wall, so the immune system doesn't have to fight this crazy, unnecessary war in the first place. And that really just leaves us with one final question for you to think about. If you've been stuck in that frustrating cycle of temporary fixes and recurring symptoms, maybe, just maybe, the answer you've been looking for isn't on your dog's skin at all, but is waiting to be found deep inside.